Hi, Michelle.
Hi.
Welcome. So I'm really excited to have you here because we go way back, and now there's just a need to talk to someone, an expert, about this topic that it's personal, but also, of course, since I work with a lot of people who are pregnant, it's something that comes up sometimes. And you helped me with this issue, so I asked you here to talk about the topic of hyperemesis. Hyperemesis gravidarum is the full name, or HG, and then just like nausea and vomiting, morning sickness that goes along with pregnancy. So those are kind of similar topics, but you know a whole lot about it because you helped me with it many years ago. And so would you introduce yourself, who you are and who you help?
Absolutely. My name is Michelle Weston, and I am a licensed acupuncturist and herbalist. I have my bachelor's degree in psychology and then a master's in Oriental medicine, which I acquired in 2002, which means I've been in practice around 23 years. I also grew up with a father practicing acupuncture, and my mother was a midwife for over 30 years. And so even as a child, I saw the myriad of benefits that Chinese medicine can offer women during pregnancy and childbirth and motherhood. During my peak years of my childbearing years, I trained and worked as a doula as well. I saw a lot of pregnant clients during that time, attended some births, and also did some acupuncture during labor, which was an incredible experience. So I've really been honored to work with women at this really unique and special time in a woman's life.
Well, I can definitely vouch that you helped me very much through that unique and sometimes difficult time, specifically with hyperemesis. So for me, the experience was terrible. I just got pregnant and then started feeling really terrible and couldn't keep down water or food and lost a lot of weight and thought this was just normal morning sickness. My mom had it. But I now know that that was way beyond normal morning sickness. And I did not know how to get help with that. I just kind of was trying to tough it out because I thought this was normal. And finally had my sister tell me that I should go get some help with this. She's a nurse, and she said, "You are not doing well." So my sister-in-law was an acupuncturist at the time, and she suggested I find someone. And I found you, and immediately felt better. So even, just the first session, we did some needles, we did some herbs that you sent home with me, and I was able to hold down water finally. And then after just another session or two, food. And I stopped vomiting after just a couple of weeks of treatments and was able to stop vomiting for the rest of my pregnancy. Now, it wasn't 100% perfect. I still had some nausea, but I mean, just being able to hold things down was a dramatic difference. And now that I know more about HG, having done a lot of research and listened to a lot of people's stories going through it, my sister-in-law, she was hospitalized multiple times with it in both of her pregnancies, was on a lot of medication. Sometimes it worked, sometimes it didn't. And was, miserable. She was spending so much time in the hospital during her pregnancies, and a lot of people have that similar experience. And I felt, now that I know that it can look like that, I feel especially excited and grateful that I found acupuncture in you when I did. And so I just, I'm writing an article about HG, about morning sickness, and I just knew I needed to talk to you about it and how you work with people to make them feel better in this way, because it's something that's not well researched. So it's hard to find information about it. So if you don't have much experience with acupuncture and you decide to just go online and say, I'm throwing up all the time, I have terrible morning sickness, what should I do? Acupuncture is probably not going to come up as one of the most obvious solutions. And so we'll talk about it here. And so maybe we'll get the word out a little bit. So you obviously have worked with people who are experiencing hyperemesis, morning sickness. What, with HG specifically, what do you see that might be special or different about these patients? Like, how is it different than just the typical morning sickness?
There are some women that get the diagnosis of HG that had a foundation prior to pregnancy of a weak constitution or a weak digestion, that sort of set them up in that way once they became pregnant, but that's not really true across the board. So I don't know that there's anything definite to say you will or will not end up with this type of symptom during your pregnancy. Sometimes the hormonal changes of pregnancy are just so profound. They affect every system and disrupt the pathways of digestion for a lot of women. So sometimes there's a foundational premise before, and sometimes it kind of just comes out of the blue. In terms of what's important about it is just how impactful being able to eat or not being able to eat while you're growing a baby. I mean, it's very, very important to get hydration that will stay down and go to all of your cells, and nutrition that will stay down and go to all of your cells while you're doing all this incredible creation work. So yeah, I'm really glad that you sought out therapies for support. And I like that you mentioned, some people will get relief with medication and some people won't. Something that's very cool about acupuncture in and of itself as the sole modality is that you can use it in replacement of medication. You can also use it in conjunction with medication. So there's no contraindications. Typically when we're working with herbs, you might do one or the other. You might do the medication or you might do the herbs. And people tend to have a strong preference if they'd like to do something natural, or if they tried the medication and it doesn't work, they may stop. But acupuncture you can do in conjunction and kind of get a synchronistic effect if you've already kind of gone the medical route, the medicine route.
And that's a good point that I didn't write down this question. This is going to be off the cuff, but that sometimes you should not use herbs if you're using other medications, because I think what a lot of people don't recognize is that herbs can be very powerful medicine, very powerful compounds. And there can be, crossover effects if you're taking them with the wrong other things. And so, yeah, to definitely be communicating with all of your care providers about what you're taking or planning to take to make sure that it's safe. Even though they're herbs, they can still be pretty powerful medicine. So.
Absolutely. And we're incredibly conservative in our training when it comes to what acupuncture protocols and what herbal medicinals we would use with a pregnant client. So that's kind of a baseline of education where if there's any contraindications. And then when it comes to combinations with medicine and herbs, we do know a lot of the synergistic effects, so that you'd want to be careful not to take two things that are doing the same physiology in your body, because it would have an over effect. But also, what was I going to say? This is where I would want to edit.
It's okay.
What we were saying about the medications. Shoot.
Well, I know that you need a prescription for a lot of the medications, a lot of the herb, medications that you have and that you offer as a solution to people. I know myself, I'm taking some herbal supplements for perimenopausal kind of stuff, and I can't just go buy them online. I have to be seeing an acupuncturist, a licensed acupuncturist, and they have to give me a prescription. I have to go to a pharmacy to get it.
That's right. And you stimulated what it is I wanted to say, which had to do just circling back to what you were talking about in terms of research related to Chinese medicine. So there are some studies that have been going for quite some time about contraindications with herbs and medications. but there's not a lot relative to how many Chinese medicinals are out there. And so because of that fact, that's why we're really conservative about our applications. Not that there's necessarily a dangerous pathway, but there's not enough evidence. And so we'll just keep it in a very conservative approach. And some people are so unfamiliar with herbs just as a concept that they're not comfortable. They're like, I'm pregnant, this is new for me, and I'm not exactly comfortable taking something that I don't know and can't buy off the shelf myself. And that's fine, because we can use acupuncture, and also there are a couple of other modalities that are helpful to support the hyperemesis, and we can just use what feels best to the client, because their comfort level, their nervous system is all part of the picture, right? So you don't want to give someone that they would be nervous about, and that just amps up their digestive fire anyways. So we have lots of avenues with which to work with clients, kind of where they're at.
Yeah. And I remind myself that that the Chinese medicine practices have been around for a very long time. This is kind of standard care in a huge part of the world for a very long time. And so there's definitely plenty of proof, plenty of evidence that, you know, certain things are safe and certain things are not. And so it's definitely been proven.
What they call it empirical evidence versus studies. And it's very hard to fit Chinese medicine into the Western model of scientific method because it's so individualized. So one person with hyperemesis that comes in may have underlying adrenal fatigue. They might have underlying digestive weakness. They might have underlying nervous system issues, depression, a variety of things. So the protocols for hyperemesis will be somewhat similar, but I'm always treating the whole client. And so the exact treatment I give them will be different than the next one who comes in with a slightly different presentation. And because of that, the scientific method and saying, let's do a whole study and get a single result, it's like putting a round peg in a square hole because every treatment's going to be different. The next time the person comes in, the treatment might be slightly different. And that individuation is actually what helps make it so effective, but it hinders it from being put into this very neat and tidy box for medical research. So when we talk about it being effective and having lasted over thousands and thousands of years, it's more what we call empirical evidence than scientific research. And that's hard for a Western mindset to really validate. Then people find themselves in a position like you were, really desperate in discomfort or pain or depression, and they come and experience it, and then they realize, oh, yeah, there's this really incredible impact that is provided. So,
Yeah, the randomized controlled trial is kind of the gold standard over here. And it's great for a lot of things. And like, I have a background in doing that kind of research in the pharmaceutical industry. And so like, I have lived it. I have definitely lived that level of research, and I see the value in it for a lot of things. But then I also understand that it's not always appropriate. It's sometimes there's, you just can't, like with acupuncture, for example, you try to find randomized controlled trials about acupuncture and, where you have to have a placebo group, and you can't really like fake putting needles in somebody. So,
Well, they talk about using real acupuncture points, the ones you find in a textbook, and then fake acupuncture points, which shows how much they don't really know, because there's actually something in base education you learn. It's called an asha point, which means any point, whether it's on a meridian or not, that is tender is an active point and available to be used. So there are no fake acupuncture points. And I wouldn't have 10 clients with hyperemesis or 10 clients with migraines and apply the exact 6 acupuncture points to those same patients, which is what they would want to see in a study. Like, here's some stability, some predictability. And it doesn't work that way. The individuation is what actually makes it effective for each individual person, because we're so different one person to the next.
And I remember that you would do something a little bit different each time. I mean, there were some things that I could expect, but then sometimes, and you always, what I love about the treatments was, I mean, first of all, it was always very relaxing and enjoyable. It was just a time where I could just, take a deep breath and just be very still and quiet. And it was always a nice atmosphere and nice music. And, but, it was definitely a little bit different. And you always started with, how are things right now? Always, right? And there was always plenty of conversation before any treatment started, because like you said, you want to know, like, what's the snapshot of right now? This is really important too. What's happened since last time? So I think it's a really excellent kind of care, and sometimes we're not used to that. So but definitely I would encourage people to give it a try. Okay, so you have obviously worked with a lot of people with hyperemesis, with morning sickness, all kinds of, pregnancy discomforts and things like that. When you see somebody specifically for HG, for hyperemesis, do you feel like you need them to come in having a diagnosis already? Or like, is it something you can recognize and start treating even if they don't have a diagnosis yet?
Diagnosis is absolutely not necessary. As I mentioned earlier, a healthy digestion and a healthy appetite is so important during pregnancy. So whether there's, like you mentioned, a slight nausea, a little bit of upset, lack of appetite, or certain foods don't taste as well, on the very mild end of the spectrum, all the way to where you were experiencing, or some of those other cases that are hospitalized for not being able to keep anything down, acupuncture is going to be beneficial. And it will work on a spectrum, right? So for some people, they will experience immediate relief. As soon as we begin the treatment, things will start to settle down. That's always my end goal, is that people feel better when they leave than when they came in. And sometimes people need frequent treatments throughout that first trimester, or a little bit past that when hyperemesis is its most profound, so that the symptoms may be abated for a few days and then they want to come back. And I find that to be very normal and common, because the dramatic changes that are happening in your body are still happening, and they're going to happen for 9 full months and then some afterwards as well, in early months and years of motherhood. And so a lot of women get continued relief if they, say, come for a series of treatments during that time. You asked me, is a diagnosis necessary? So the answer is definitely no. And I think a lot of becoming pregnant, being pregnant, becoming a mother brings women in and brings them in tune with their intuition. And when you feel not right, that is the time to come and get some support and some care from your Western doctor, from your acupuncturist, from a therapist. If, sometimes people get mood disorders that come in during or after pregnancy. And so paying attention to what your body is telling you. And it's tricky because being a mother is brand new. So like you said, is this normal, or does it reach a point this is not normal? It's important to reflect on those observations during that time.
Agreed. And like you said, to get help for it, because I think a lot of times we go in during pregnancy with all these discomforts that are normal, and we just hear like, yeah, that's normal. You can try this or that. Maybe it'll help, but really it's just, you're pregnant. So that's just the way of it. And then we don't really hear sometimes that there might be other supportive therapies that we could use to get some relief, even though these are normal discomforts, or some of them, roll on into abnormal, like maybe hyperemesis. But they're things that are not necessarily going to hurt you or your baby, but are hard to live with or uncomfortable to live with. And that there are some things you can try that might help, and it's worth doing.
I definitely feel I have conversations with clients across the board for a variety of health conditions about quality of life. right? As we get older, like I have a little achy knees, or I have this or that, and we just kind of normalize certain parts of it. And there are some things in pregnancy that you can just tolerate. It's not really bothering your day to day. You get to work, you do your things. But if your quality of life is reduced, it's important to pay attention to that, to possibly slow down, to possibly work less, or to create some time in your life for that self-care, and see if you can get feeling your most optimum so that your body can do all these deep, things that they're doing while they're growing a baby.
Yeah. Yep. And good preparation for labor and birth and being a new parent.
And motherhood. Yes.
Yeah.
Yes,
Definitely.
I think we were talking socially that so many of the things that women go through, whether it's early in the pregnancy, later in the pregnancy, through their actual birth, all of them are kind of grinding out a pathway towards motherhood, which is you have a lot of tools and grit and surrender that are presented to you through whatever kind of pregnancy and birth and children you have. It's a pretty incredible journey.
It is. It is. And I think the longer we do it, we realize that we can be grateful for all of it. Okay, so when you start treating someone, and you kind of already addressed this by saying that your goal is for them to feel better when they leave than when they got there. But do you, like, some of the time, most of the time, almost all of the time, see some significant improvement with your treatments for HG?
Yes, I think even since I saw you, which was many, many years ago, I acquired another technique that is really fantastic and provides immediate relief. So I'll usually apply acupuncture. I don't always recommend herbs. It depends. And then I often will use gua sha, which is a Chinese medicinal tool. I think a lot of people have heard of it in the beauty world now, but you use a rounded edge tool, and you do kind of a press stroke, or they call it a scraping, along the soft tissue in the body to generate circulation, reduce inflammation. And when you gua sha on the upper back and upper neck all the way to the bra line, usually the skin of a woman experiencing nausea or hyperemesis or morning sickness will get red very, very quickly. And as you're doing the scraping and it gets red, they can experience immediate relief. We're bringing heat that's accumulated in the digestive system kind of to the surface and helping things to settle back down. The digestive system is meant to go in through the mouth, down and out. And during nausea and vomiting, the direction of the digestion is going the wrong way, right? And creating lots of heat in the body. So just clearing that heat in the upper part of the body helps to settle things down fairly immediately. And then, so that's kind of become my go-to thing that I'll do first. And then they're even more comfortable and relaxed to lay with the needles in. Oftentimes people will rest 15 or 20 minutes. Many times they fall asleep, which people cannot believe. How do I fall asleep with needles in? But it's so centering and relaxing. It brings you into that homeostatic space that you're in, like kind of right before you fall asleep, where everything's gelling. And so people do fall asleep fairly often, and they wake up feeling really refreshed and better. Yes.
Yeah, I cannot nap. I'm a terrible napper, but I always fall asleep during acupuncture. It's just, yeah, I don't know how that happens, or you just described how that happens, but yeah.
Yeah, I mean, we're really encouraging the nervous system to do a reset. Mm-hmm. So much like meditation, much like a micro nap, it's like, let's pause and line up all of our communication between our internal organs to kind of do their best job while nothing else is going on. And yeah. Very rejuvenating.
Very, I agree. Okay, so you would say that most patients do get some improvement.
Yes, and so then, like I said, it really varies on the person's constitution, the intensity of their work life, the intensity of influx of new hormones during that time from 1 week to another, whether those symptoms stay away just for that day, for a few days, for 10 days. It really varies. And that gives us a barometer of how often they would benefit from having treatments. And typically, as the weeks of pregnancy go on, that can stretch out. So the treatments will be somewhat cumulative, but the symptoms may very likely resurface. And it doesn't mean that it's not working. It just means that you're still pregnant, right?
Yeah.
And your body is still having this intense response. I do often recommend some home care self practices. So we talk about hydration, we talk about nutrition, things that I've learned over the years from my own midwife about ways to stabilize your blood sugar and even improve low levels of nausea throughout the day. And then I have often taught a pregnant woman's partner how to do the gua sha at home. I have the little tool, I give it to them, or some women already have one, and it's really not complicated, and they can use that as a follow-up to the treatment to support, especially if they can't come in as frequently as their symptoms are presenting themselves. They can do some of these home care modalities to further along their relief.
Yeah. And I mean, I just thought of it as like, okay, I can, if I needed to take medication, if that was something that would help me, I would have to take it every day, multiple times a day. And so why would I think that going in for this kind of treatment would mean I only do it once and I'm done, right? I would assume I would need to keep, do maintenance. And I did, but you're right. I remember going less often, and I remember being a little bit sad about that because I liked it. I got those micro naps. But I know at first I wanted to go in as often as I could because the difference between feeling that the intensity of that nausea, when you have hyperemesis and you can't even keep water down, like I honestly can't think of anything worse. Like I've had broken bones. I've had, all kinds of things that are very painful, uncomfortable. But to me, there was nothing worse than that. And the relief was very, very quick, and just, I would have done it every day if I'd needed to, or if I could have, but, so yes, I think that, most people who are having this are definitely going to want to try things that will help them for sure. Okay. So you kind of went through, you sometimes herbs, but not always. Acupuncture, pretty much always. So the needles, and there are different points, so different parts of the body where you would put those needles. For someone who's never done acupuncture before, would you describe the needles, what they look like, what it feels like?
Do you want to see one? That's what I like to do with a brand new patient, because the word needle already stimulates a negative reaction to people. I think most people's experience are with a hypodermic needle that is hollow, that you get a shot with. Some people tolerate those fine, but the idea of needles, a treatment with those types of needles, sounds really very uncomfortable and very unlikely you'd fall asleep. So an acupuncture needle is not at all hollow. It's solid and it's very thin and flexible. And I use a Japanese style needle that is silicone covered. And so it's very smooth. Many times people do not feel the needle going in, or even with my style, the stimulation of the needle. Some practitioners like to do a strong stimulation. I don't necessarily. And still you will experience a differentiation in sensations within your body. So for new patients, I usually take a lot of time and explain what I'm doing and make sure they're very comfortable. And I do show them a needle, so I'll get one so you can, if you can see it even on Zoom.
I was going to say, I'm not sure we'll be able to see it because they really are so tiny.
Yeah, they're really tiny, and they come in a pre-packaged, so everything's hypoallergenic and clean and everything. They're single use, and they go into Sharps container afterwards. You can see this. I'm holding it up to my camera. This has a red top, and this is a plastic guide tube. So you'll always feel the guide tube pushed onto your skin. But I use the guide tube, and then I tap the needle in, and I don't even know, where's my camera? Can you see?
Just barely. Oh,
It's
against
like,
your black scrubs, you can see it better. If you
okay,
kind of
against my
down a little bit, you can kind of see it. Okay.
here.
Just the hair, yeah.
I mean, it's flexible and very, very thin. And
Mhm.
so even sometimes I'll show a new patient, this is what you can expect to feel. I'll put my hand here, you'll feel the guide tube, and then I tap the needle in, and this is what it looks like. Maybe by now people have seen it on TV, but it's very different than a lot of people expect. And like I said, oftentimes they don't even really feel the needle insertion. They don't really even feel the very micro stimulation. What they feel is that deep centering, that relaxation, relief and stagnation in the body, whether it's digestive or muscular or whatever. That's the most usually what they feel.
So I'm a natural cynic, and I remember hearing about it for the first time. I was in college, and my university was hosting a health fair. And so they had people checking blood pressure and, talking about all the things, the health fair. And
Yep.
there was an acupuncturist there.
I've done those.
First I'd ever heard of it. And, started listening. I was like, yeah, sure. You're going to put needles in somebody and make them feel better. But they were doing a sampling. And so they took my arm and put 2 needles in my forearm. And my forearm went like limp. It was like numb and limp all of a sudden. Just like, it's hard to describe it, but it just felt very different from the way it felt before those needles went in. And so, like, obviously it did something. And that's when I finally kind of started to consider it and take it more seriously. And what you said about more stimulation or less stimulation, your methods, there's not as much stimulation. I've definitely had the experience of feeling the needle or not feeling needle go in at all, and not really feeling anything. And that's why you have the nice little colorful plastic part on there, right? Because if you can't feel it, how do you know it's there? And how are you not going to just walk out with a bunch of needles still left in you, right? You've got to be able to see them, so you make sure you get them all. But I've also had the experience where I really feel it, and it feels like electric almost, just like, or even like hot, like a burning sensation, not like painful, although I guess I have had that happen before, but very rarely. But mainly it's more like just like a tingle, like a major, I don't know, it's something funny, but it's obviously there's something. And so
So there, acupuncture exists worldwide. There's Chinese style, there's Japanese style, there's Korean style, and different styles emphasis getting a chi stimulation, an energetic stimulation required for the efficacy of the treatment. And I think some of those stronger sensations tend to be in places in the body that overlap with neural pathways or muscular insertions, things that will have a stronger sensation when stimulated strongly. Japanese style is a more subtle and much more comfortable, especially to Western culture. We like to be comfortable. And I think it really helps people to relax too. If you're used to getting a bunch of tattoos and working out really hard and doing things that generate strong stimulation in your body, I think you could be fine with a strong acupuncture treatment. But most people are pretty wound up and actually need to be settled down. So applying a more gentle style of acupuncture and letting the nervous system really get into that rest and digest state versus the fight or flight state, I think becomes really important for people in our culture. And I think, and women in particular, like getting to have that inward downtime and being able to relax is an important foundation for doing healing.
Yeah.
Yeah.
And it's being integrated more. I know that like my uncle had a stroke a few years ago, and there was an acupuncturist on staff at the hospital, part of the stroke team, because they've seen some really great work with that as part of the treatment. And then when my mom was having cancer treatments at MD Anderson in Houston, an acupuncturist would come to her room. Some of the side effects from the chemo and treatments, she was a lot more comfortable with the acupuncture afterwards. So it is being integrated more, and I love seeing that. And it's being integrated, even in hospital systems because it works, right? They would be having.
It's interesting that what we talked about earlier, how there's going to be still not enough research studies kind of proving it works. And at the same time, it is permeating spas and hospitals and rehab centers. Even 20 plus years ago, when I was in school, we were at a veterans clinic working on phantom pain and working on all kinds of complex post-stroke patients, things that, Western medicine has a set of things they can do, and then they're at a standstill. And you still can acquire relief and benefit from acupuncture. And so, although simultaneously the research isn't exactly keeping up with the efficacy, like you said, it still works. And so some of it is a little bit of a mystery. Like, as I mentioned, some of the acupuncture points go right over a muscle bundle or a neural bundle. And so we can say from a Western medical perspective, oh, I think this acupuncture point is doing this. But many of the points don't interweave with a neural pathway or a muscular pathway. And so it leaves a little bit of mystery, like, how is it still working? The style I've been practicing the last 20 years, I do a lot of reflex checking in the body, so areas of discomfort. And then I just put my finger here and I say, I'm going to check and see if I might use this acupuncture point. Do you feel any relief? And people have a very hard time, their brain is saying, you just put your finger here and somehow this is better. I haven't even put the needle in yet, but I'm just checking, will this probably work for this person? And people are very surprised, and they are kind of a question, I think it's better. Like, how is it possibly better? So there's still some mystery after all these years as to how it's actually working, but it works.
Yeah. Okay, so herbs, acupuncture, gua sha. Is there anything else that you kind of that might look very different from those kinds of treatments that you do for HG?
Just primarily the two things I mentioned earlier, which is hydration and nutrition. So if we can get the baseline, and I do talk to all my clients about those things, but it's incredibly more important for these patients that already have not been able to eat or absorb much of what they have been eating, that we can find a way to slowly balance that into their day-to-day. So we get the symptoms much reduced. So maybe they could have an inclination to eat. And then we talk about how to do small foods throughout the day, which types of foods that are palatable to them, what it means to hydrate. So if you've been vomiting, and the same is true if you have a lot of diarrhea, you're actually dehydrated. When you drink a big glass of water and then vomit it back up, you're actually perpetuating that dehydration cycle. So something as simple as when you're trying to rehydrate, you do your hydration in teaspoons, very, very small amounts, and see if you can keep it down. And when you're dehydrated, it actually exacerbates the vomiting and the nausea, right? So it's this self-fulfilling cycle. And then you're so thirsty, and then you chug the water, and it just keeps going. So even something as simple as when you get to a place where you can maybe stomach a teaspoon of water, that you're rehydrating at this very incremental pace so that you can keep down what you have. The cells get a little bit more hydrated, the nausea gets a little bit less. So we're getting to this closer to this place of homeostasis. So I'm very particular about educating HG clients about that, as well as when we're talking about nutrition. I learned a really cool technique from my midwife. Maybe you heard something similar, but to actually set an alarm in the middle of the night and have something by your bedside, a little bit of protein, like a bite of protein and carb, because blood sugar dips that happen if you go for long periods without eating will also exacerbate nausea and vomiting. So if you can preempt it, and I'm talking like 2 bites, like right by your bedside, peanut butter sandwich, something like that, go back to bed, it will keep the overall blood sugar throughout the day and the night more even. So we talk a lot about eating evenly, small amounts throughout the day and even throughout the night. And if you bring down the symptoms to a tolerable amount, and then you add in these small titrations of hydration and nutrition, that really works synergistically for these particular clients to get in a much more stable place.
Yeah, and I think sometimes that's the piece that's missing from the more standard sort of treatment plans for this, because there are some medications that have great effectiveness. I mean, there's a lot of, in this article, I'm going to talk about medications as well and what those options look like. And, for example, the Zofran, which is kind of now becoming the gold standard, but there's still a lot of care providers who are kind of using old information to say that, no, that's not safe to take during pregnancy. And unfortunately, that's too bad, because there's research out there that it is, but done a certain way. And also it's, there is like you're saying with reintroducing food and water, same with the medication. Like, it's not necessarily the way that you would normally give it to a different kind of patient. And so making sure that they're following these protocols that are more correct for HG patients. And then also, though, like, sometimes it doesn't even work for some people. Even like the most ideal treatment schedule doesn't work for everybody, because, like you said, everybody's different. And so there's not really one standard treatment that's going to work 100% of the time for every person. But I think something that's missing is, like you said, okay, this medication, this treatment, this acupuncture, whatever, is going to make you feel better. But then what are you going to do now that you can eat a little bit more? Now that you can, how are you going to do it in a way that means, like, you'll continue to feel better instead of restarting this whole thing again?
So I think one thing, when you go to see your doctor, you have a regularly scheduled visits, and they're pretty far apart, and you're given a protocol, and you're a little bit on your own in terms of how to see if it's working for you. And although some people are not used to coming to see an acupuncturist, like we mentioned, maybe every week for the first trimester, every single week, not only do you get the cumulative effects of the treatment, but you get that individualized care. Like, we're talking about how it's going for you, what is working, what isn't working, and tweaking your protocols at home so that you can feel your best. And so I think that's something that's unique to acupuncturists in general and alternative medicine. We sort of have this space in our lives to take more time with our clients, and we can help them more specifically where they're actually at, taking that time to talk and listen and I'm really diligent about taking good clinical notes. So I remember what they said last week, which is very important if you're dealing with persistent vomiting or persistent pain, because if it's some better, but it's not gone, your brain is like, I'm still, uncomfortable. But if I've written down, oh, well, you were puking 3 times a day and now it's once a day, we're on the right trajectory. Yeah. But it's very difficult when you're in it to feel that way, because you're like, well, it's still here. But it gives us feedback that we're on the right track. Let's keep going in the same direction, and we're going to get you to that place of stability that you're looking for.
Yeah. And with hindsight, because like I said, I never got to be completely nausea-free for the entire pregnancy. I mean, I remember it felt like the minute my daughter was born, I was like, somebody bring me some food. I am so hungry. And that was like the first time I felt hungry in 9 months. Right. And so I remember feeling that discouragement of like, but I'm not 100%, I'm not 100%. I still have nausea. But looking back, like you said, like, wait, I was puking 10, 15 times a day, and now I'm not puking at all. Like, that is huge improvement. And that does help. It helps a lot to recognize that. Okay. I had just a couple more questions that again, I didn't prepare you for, but with the herbs, because I remember feeling a lot of nausea, and then you're giving me this stuff to put in my mouth that smelled and tasted terrible. I didn't always want to. I did it, and I was keeping it down. But do you have any tips, or do you do things a different way, maybe with the herbs, with someone who's having that extreme nausea and having a hard time?
Yeah, so some of the herbs are kind of bland tasting, and some of them are stronger than that. Um, I guess, were a compliant patient and were able to take them even though you weren't wanting to take them. But for some people, they might have a gag reflex or a smell or something. If they're not able to keep down food, that the powdered herbs, which is what we used at the time, are just not, they're not going to go down. So we have herbs that are in pill form, so they don't really taste them. And that would be one modification. And if someone really can't stomach them, they might benefit more from the other modalities, the acupuncture and the gua sha and the titrating the nutrition, even more so than the herbs. So we just have to be flexible and see what works for each client.
Okay. And then the last thing, just kind of like, what does a typical appointment look like? If you're going in for HG for specifically, I guess, like
Yeah.
how long does it take? Like what does it look like?
Yeah. Well, the onset is not too dissimilar from a regular medical visit. There's required forms you've got to fill out, and I can get your medical history. But then I have a nice long conversation with each of my clients, what they've been experiencing, what they've already tried, if it's worked, if it hasn't, what their comfort level is with the idea of acupuncture, if they've had it before, if they had a good experience. So I'm pretty thorough, especially with a new patient. To really get a sense of what they're bringing in to the office. And then, like I said, I will show them a needle. I'll explain all the modalities. I will typically check their pulse. I will typically check areas on their body for tenderness or pressure pain, and I'll use those reflexes on the body, the pulse, and what they told me to guide me as to what points that we're going to use. And like I said, I may start with the gua sha for some clients. I may start with the acupuncture. If clients are open to it, sometimes I'll do some body work. Most pregnant women wouldn't mind hands or feet or neck or something like that. So depending on our time in the session, I like to do that. It just affirms that state of relaxation.
So you mean like massage? Sort of like
Yeah, I am a licensed massage therapist, but the body work I do tends to be more like acupressure style rather than Swedish massage, where I might hold certain points and hold the occiput for muscular and nervous system relaxation. That way I'm also not pulling on the soft tissue while the needles are in. So it's a little bit more static, but equally as relaxing. And like we mentioned earlier, people oftentimes fall asleep. So sometimes I don't put my hands on them at all and they just knock out, which is good because the body will go into a state of relaxation, and I can almost hear when they resurface. They take a deep breath, their eyes pop open for a second, and they've kind of done one full cycle of recentering, and I'll take the needles out. Depending on where they are in their pregnancy, I can treat them usually face up first and then either on their side. For some that are still comfortable on their tummy, we can do that. Usually there's 2 rounds of the treatment, and sessions last anywhere between 40 minutes and an hour and a half, really just depending on how much care they need. And so I'm flexible that way.
Yeah.
Yeah.
Yeah. It was always, a significant amount of time
Yeah.
spent there. So it's not.
Well, and if I have a very busy working client and she's like, I have 45 minutes, we've already done all the, me, like I'm in to put the points in, I definitely can do that and do work that way with clients that need it, so they can get 20 or 30 or 40 minutes to reset and get back to life.
So 20 or 30 or 40 minutes with the needles in, where they're just
Right.
resting, they're still letting the needles do their work.
Yes, absolutely.
Yeah. Okay.
Yes.
And are people generally fully clothed? Like, what do you recommend as far as like what to wear to an appointment, that kind of thing?
I like clients to wear loose and comfortable clothing. That way I can keep them mostly clothed while I get to points on all of the limbs. Sometimes I do treat the abdomen, and a lot of times if I flip them over either on their side or their back, I'll have them take their shirt off so I can work along the back. Particularly if we're going to do the gua sha, they need to take their shirt off because I work from the base of the neck all the way to about the bra line, all the way out to the edges of the shoulder. So having a clear back to work on is helpful. And like I said, as that heat comes to the surface, clients are always commenting like, oh, I feel better like right now. Like as the back is getting redder, they say, oh, I just got a sudden, next layer of relief. It's really fun, actually.
Yeah, that would feel really fun. I'm sure. Okay, that's all I have. Do you have any final words, final bits of advice?
No, this has been awesome to talk to you, and I'm really glad to have the opportunity to talk about this topic. Like I said earlier, my favorite thing, the reason I do what I do, is that I like people to feel better, and this is such an intense set of symptoms for people, and that the relief can be so profound, and it makes it really enjoyable because I want people to feel good, and yeah, I'm glad to talk about it.
Well, I can vouch for it. You do great work. Made a huge difference in my life and my pregnancy. So thank you. Thank you for being here. Thank you for doing what you do.
Thanks for having me, Allie.